All right, good afternoon, everybody, and thank you for taking time to learn a little bit about managing healthcare expenses in retirement. My name's Emmett Corboy. With me is my partner, Josh Fisher. We are 1/3 of the Wealth Cycle Advisors team here at Cetera Investors, and we're excited to spend about the next, 45 minutes or so, maybe a little longer, maybe a little shorter, going over this very important topic and one that, we get a lot of questions about. So one thing that I will say is questions that you have, questions that come up, definitely utilize the Q&A function within today's meeting, or if you need to put it into the chat, you can do that. Any individual personal questions or anything we may not address directly today, but we can definitely talk with you offline. And if there's anything that we can't answer, we do have a team of experts that we'll refer to a little bit as we go throughout today as well. Those who deal strictly with Medicare. What we're going to focus today on is really, Medicare within the context of your overall financial plan and things to consider as you kind of go throughout retirement or your retirement transition. So I heard a term not that long ago called bluff, right? Bottom line up front. If any of you are tied at all to the military or anything along those lines, you might be familiar with that writing and communication technique. So I'm going to start by giving you the bluff here with three key points. Key point number one is that if you do not enroll in Medicare on time, you will pay a monthly penalty. A lot of baby boomers don't know if or when they're supposed to enroll in Medicare, but there are very clear rules on when you have to sign up. And if you don't sign up within a certain window, then you'll be assessed a monthly penalty that you'll have to pay for the rest of your life. So we'll take some time to talk about, when that time is. Key point number two, if you do not have the right private insurance to go through, to go with Medicare, you might pay too much in premiums or out-of-pocket costs. So it's important that you kind of, find the right, supplement, Medicare Advantage plan, or whatever it is, because Medicare does not cover everything. Things like prescription drugs are not covered by Medicare, right? So in order to have coverage for these out-of-pocket expenses, it's important to have private insurance as well. So we'll talk, more about your options there and show you how that works. And the third key point is that if you do not prepare for the higher healthcare costs in retirement, you could run out of money or not be able to get the care that you need. People are usually happy to go on to Medicare when they turn 65 because it gives some relief against, higher health insurance premiums. But you need to be, prepared to factor in higher future healthcare costs into your retirement budget. The best time to do that is now, and you'll see what I mean, a little bit later in our webinar today. So, three parts of what we'll go through in our agenda today. Part one is, where we will talk about Medicare enrollment. We'll talk about, first off, what is Medicare, who needs to enroll in Medicare and when, and then how do you enroll in Medicare. In part two, we'll be discussing the private insurance that goes with Medicare. To understand the public-private partnership that is Medicare, we'll talk about how much Medicare costs, what it covers, almost or more importantly, what it doesn't cover, and how private insurance integrates with Medicare as well. And in the third part, we will talk about how to prepare for higher healthcare costs in retirement. There are two key reasons why our healthcare expenses will be higher in the future. One is inflation. That's something that's been top of mind for a lot of folks in the last few years. The other is the increased need for healthcare services as we age. Generally, folks, maybe in their 80s or 90s are, having more medical procedures or need more care than those in their 60s and 70s. So one expense that needs to be prepared for is long-term care. Some of you may have had experience with a parent or another relative needing help with activities of daily living, like bathing or dressing. Many are surprised to find out that these long-term care costs are not covered by Medicare, right? So that's something that we'll, touch on a bit in part 3 as well. Okay, so we're going to get this education started by talking about Medicare enrollment, and I will pass it over to Josh to handle part 1.
So who pays for healthcare in the United States today? Well, if you're under 65, your health insurance is usually work-based. So if you're still working, your employer probably provides health insurance. If you're retired, you may be covered under a retiree health plan, or maybe you recently left your job and you've had extended coverage from your employer under your own expense using COBRA, or maybe you've purchased your own individual health insurance policy. Generally, after age 65, Medicare usually pays first. That is, in our health system, the way it's set up, that once a person becomes eligible for Medicare, most private insurance becomes secondary to Medicare. So when you incur a healthcare expense, the bill is submitted first to Medicare, and then afterwards, Medicare pays what it's going to pay, and then any other insurance you have may pay some or all of the rest of the bill that's due. The general only exception is included with employer group plans that cover 20 or more employees. So if you're still working and covered by such a plan, or if you fall under a spouse's healthcare coverage, your employer would still pay first, even if you are kind of enrolled in Medicare under those situations. This does have implications for enrollment, and I'll show you what that looks like in just a moment. So what does this all mean is that unless you're covered by an employer group plan, again, that 20 number of employees or more, you must enroll in Medicare when you turn 65. If you don't enroll in Medicare on time, there are kind of pretty significant consequences. We'd even call them dire. I mean, for the first, you'll be charged a late enrollment penalty. And the longer you go without enrolling, the higher that penalty will be. And it'll continue for the rest of your life. So you have to enroll in it. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is a primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up being stuck with the entire bill. So we've got two very dire points here that we have to consider as it pertains to making sure that this is on the books. Okay. So if we back up just a moment and say, what is Medicare? Well, it's just a national health insurance program for people over 65. It was signed into law effectively in 1965 by President Johnson, and it's administered by the Centers for Medicare and Medicaid Services. And the enrollment of Medicare is actually handled through the Social Security Administration. So everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits, and our discussion today will pertain to the first group of people over 65. So as we kind of break down Medicare and put it under the microscope, it's basically divided into 4 parts. Part A covers the cost of hospitalizations. Part B covers the cost of medical services, such as your doctor's visits, procedures, and diagnostic tests. The bills for Part A and Part B are paid by Medicare. Part C and D are where the private insurance comes in. So Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all your insurance services under Parts A and B, and usually prescription drug coverage as well through the plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is the prescription drug coverage, and it's also offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different, which is why you want to shop carefully for the drug plan. Even if you don't take any prescription drugs when you first go on to Medicare, you'll want to sign up for a Part D drug plan, because if you go without drug coverage for very long, you'll face a penalty when you do finally enroll. So just as a quick comparison, this image kind of gives us two ways to look at Medicare. So if you go with the original Medicare plan, you sign up for parts A and B, then you decide if you want that prescription drug coverage under Part D. This shows drug coverage is optional, but it can be dangerous to go without the drug coverage. So we're recommending that everyone plan to have some kind of prescription drug coverage starting from the onset of Medicare. In step 3, you'll decide if you want supplemental coverage. And again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves too many gaps. So if you're receiving Social Security when you turn 65, you will automatically be enrolled in parts A and B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you'll decide or you'll decline it, excuse me, and otherwise you'll go ahead and accept parts A and B, and your coverage will start on the first day of the month you turn 65. Parts C and D aren't automatic. If you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with the original Medicare and have a standalone Part D subscription drug plan, you'll need to decide which insurance company's plan you'll want to go with, and you'll proactively enroll. And obviously you should do this at the same time you're enrolling in parts A and B before your 65th birthday. So what if you're not receiving Social Security when you turn 65? More and more people are continuing to work, or at least delaying the start of Social Security in order to receive a higher benefit. In this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. There are 3 main Medicare enrollment periods. The initial enrollment period applies if you're not covered by a group plan that covers up to 20 or more people when you turn 65. So if you're covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll explain in just a moment. If you miss either one of these enrollment periods, you can sign up for Medicare during the enrollment periods. You can also sign up for Medicare during the general enrollment period. So there's kind of 3 windows that you can take advantage of. But once we kind of miss one, we want to be very careful because, again, we'll illustrate, what are the implications of missing those special windows, timeframes, and that sort of thing. Okay. So the initial enrollment period for people who aren't covered by a group plan at 65 starts the 3 months before you turn 65. So just look at your birth date when you're leading up to 65, and we've got that window of 3 months prior to that. And it basically lasts until the 3 months after you turn 65. So you've got basically a full 6 months to kind of get things in order to begin your enrollment. But although it lasts a total of 7 months, you really should plan to enroll in Medicare during that 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month when you turn 65. By the way, if your birthday happens to be on the first day of the month, everything is moved up a month. So just pretend your birthday is in the previous month. For example, if your birthday is on June 1st, your initial enrollment period would start February 1st. And if you sign up during February, March, or April, your coverage would begin May 1st, that 1 full month before your actual birthday on the 1st. We've been talking about signing up for Medicare as a whole, but there are times when we need to break it into different parts. Most people will sign up for everything all at once, but there may be times where you'll want to sign up for some parts and not others. So again, it kind of plays into this scenario. If you're still working when you turn 65, you would really want to check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you're covered by an employer group plan when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at 65. Reason is that it may actually offer better coverage for hospitalization than what you're getting in your employer group plan. And so Part A is usually free to you, but just check with your benefits administrator if you're in that situation to see if it makes sense. If your employer group plan uses a high deductible health plan paired with a health savings account, and if you want to keep contributing to that health savings account, you should not sign up for Part A. The reason is that once you enroll in Medicare, your HSA contributions must stop, okay? But just let me be really clear. If you have an HSA and your employer covers fewer than 20 employees, you'll have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. So, it all stems back to the type of health plan and then how many people are actually covered under the group insurance to kind of dictate, which path to take as far as if those situations were to hold true in your personal situation. If you're not covered by an employer group plan when you turn 65, you'll want to sign up for Part B during your initial enrollment period, preferably in that 3-month period before your 65th birthday. So if you're not working, if you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during that initial enrollment period, okay? If you signed up for Parts A and B during the initial enrollment period and you think you'll ever in your life you want to add prescription drug coverage, then again, we encourage you to enroll in Part D at the same time. And if you go more than 63 days without credible prescription drug coverage, you'll pay a late enrollment penalty when you finally do sign up for Part D. So it's better just to go ahead and get your drug coverage from the outset, even if you aren't currently taking any prescription drugs. As we mentioned before, you have 2 options. You can roll in a standalone prescription drug plan, or if you get original Medicare, and if you have a coverage through a Medicare Advantage plan, that's how the prescription drug would come into play. Okay, so that takes care of some of our initial enrollment period details. Now we're going to talk about the special enrollment period. And again, this is going to be more so for those people who are covered under an employer group plan that has 20 or more employees when they turn 65. In this case, obviously, if you're working and the plan has that structure to it, 20 or more employees, you won't be penalized for not enrolling in Medicare at 65. But you will be penalized if you don't sign up during the special enrollment period. The best time to sign up is before your current coverage ends. That way you'll have no gaps in coverage, which is really crucial. And then you will actually have a little bit of a grace period of several months to avoid any kind of enrollment penalties. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, the prescription drug portion of it, it's only 63 days. So just in a general summary, you can avoid late enrollment penalties by signing up for Medicare during the initial or special enrollment period, but to avoid gaps in coverage, which again could leave you exposed to high and expensive costs, which is really, really important, you should sign up before your current coverage ends. So last but not least, what if no one ever told you about the Medicare enrollment periods? You didn't sign up when you were supposed to. Well, the good news is that you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time that you can actually sign up for Medicare if you're outside of that initial or special enrollment period. Coverage starts the month after you enroll. So as long as you can see, as you can see here, this could leave you with some coverage gaps. So you really want to avoid having to sign up during the general enrollment period, but it may be the only option for some people. The important thing that to know in this scenario is that you can't just sign up for Medicare as soon as you realize you failed to do so. If you're outside of that general enrollment period, you have to wait until the next time it rolls around, which is January through March 31st. And again, that creates that exposure, that creates the open door for penalties and those things. And it's just a bad situation to be in. So again, we just want to make sure that you're prepared and geared up to take advantage of what's out there and get enrolled when you need to. So as we do a quick review of the Medicare enrollment periods, because again, this is really important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. Okay. Best time to sign up, 3 months before your 65th birthday, and the Medicare coverage will start on the first of the month that you turn, first day of the month that you turn 65. The special enrollment period is everyone who's over 65, currently covered by an employer plan or covered through their spouse's employer. And that plan also has to have 20 or more individuals on that plan. Best time to enroll in Medicare is before that coverage ends, and then your Medicare coverage will start on the first of the month of enrollment. And then your general enrollment period is for those people who did not attend this presentation today and didn't know that they needed to sign up for Medicare during the initial or special enrollment periods. They can sign up between January 1st and March 31st of each year when the coverage was starting the month after they enroll. Okay. So how do you sign up for parts A and B? It's really simple. As I mentioned, if you're already receiving Social Security benefits when you're 65, maybe you started collecting 62, 63, 64, you'll automatically be enrolled in Medicare. If not, you can go to ssa.gov, that's the Social Security Administration's website, click on Medicare, and then click on the big Apply for Medicare Benefits button, or you can do it by phone if you call Social Security at 800-772-1213. Part D isn't quite as straightforward because first you have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. Once you've decided on original Medicare versus Medicare Advantage, then you've chosen a specific plan, you can enroll in Part D through the insurance company or through Medicare. And this brings us to part 2, and we're going to talk about Medicare and private insurance, and I'm going to turn it over to Emmett for more.
All right, thanks so much, Josh. Yeah, so, title of today's presentation is Managing Your Healthcare Costs in Retirement. So we're going to start to talk a little bit about some of those costs, starting with, looking at just what, kind of your annual health spending might look like. Now, the figure here shows average total out-of-pocket spending in 2016 at $5,460. Obviously, that's a few years outdated now, about 7-8 years outdated, but it is the most up-to-date figure that we have. That's the latest information available. Almost half of it was for insurance premiums, while the other $3,166 was spent on services, including long-term care. So looking at those out-of-pocket costs paid by Medicare beneficiaries on the next slide there, they fall into two main categories, premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to private insurance companies offering the drug plans and Medigap policies or the Medicare Advantage plan. Out-of-pocket costs can include deductibles, the portion of the doctor bill not paid by Medicare, and also the services not covered by Medicare as well. Taking a look at monthly premiums, Part A is free if you or your spouse has paid into Medicare for over 10 years. They also say 40 quarters. So if you've, worked 40 quarters, then your Part A is, at no cost. If you're at 30 to 39 quarters, you can see it's $278 per month, and less than 30 quarters is $505 per month. So if that's you, you may want to consider, do I need to work a few more years before getting to age 65? Or if you're at 39 quarters, can you find somewhere to work and pay into Medicare for another 3 months to save you $278 a month, right? Part B, your standard premium for that is $174.70 per month. Now, there are income-related adjustments where those who are earning a higher income will pay more. And we'll take a look at that here in just a second as well. Part D, for your prescription drugs, D for drug, that is going to depend on the plan that you have, but also has some of those income-related Medicare adjustments as well. Part D is, done through a private insurance company. So that's where, it's not that standardized cost like we have with Part B. Okay, so looking at monthly premiums for Part B and Part D, including the income-related adjustment, for folks who have a modified adjusted gross income, or MAGI, single filers with less than $103,000 in a year, as well as joint filers where your joint income is less than $206,000 in a year, your Part B premium, as I mentioned, $174.70. And if you look, you can see that that number stays consistent, throughout that time, right? Throughout each of those income brackets. What changes is the IRMAA, income-related Medicare adjustment, that can be applicable. So if you go over $103,000 as a single filer, you can see you have to pay an extra $69.90 in a Part B premium, and you can add on an additional $12.90 in a Part D premium as well. So, we get a lot of questions, when we look at, folks transitioning into retirement, maybe they have, pre-tax accounts like 401ks or traditional IRAs, and they say, hey, you know what? I don't want to pay taxes on this money throughout retirement. I want to convert this to a Roth IRA. That's absolutely something that can be done. And, you need to consider that within the context of your overall financial plan and tax plan. But this is something that all too often is overlooked. And the way that this IRMAA is determined is actually 2 years prior of income. So your 2024 premium is based on your income in 2022. So when you think about like, hey, should I convert to a Roth IRA, right? You want to look at, what's your income for that year? And are there any future years where maybe your income is lower and you can stand to have more, in that overall income before bumping you into an IRMAA tax bracket as well. Another thing to think about is a lot of times, folks, kind of final income earning years before retirement are some of their highest, right? So if you're, maybe you're a single filer and maybe you're at let's say a overall salary of 150,000, right? What can you do to maybe get below that 103,000 in modified adjusted gross income, right? Maybe you want to consider, contributing more into a pre-tax 401k to lower that down, right? Now, obviously, there are a number of other deductions that come into place to get, your overall modified adjusted gross income. That's just one, but something to consider for sure, right? Which could, potentially save you some money. Now, another thing is IRMA is not permanent. If you have an income related Medicare adjustment, if you have to pay a higher premium 1 year, but then your income goes back down, then that IRMA will fall off. It is just kind of a lag effect due to the 2 year delay there. Okay, so I think I kind of beat that one to death a little bit, but there's a lot of good info there. Next, we have your deductibles. And, in addition to your premiums, there are some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,632 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance companies may cover this, and we'll take a look at that in just a minute. Part B deductible is pretty manageable at $240 a year. And this is waived for some preventative services like flu shots or, different screenings. Part D deductible is $545 per year under the standard Medicare design. But Part D coverage can be pretty complicated, which we'll, again, take a little bit more of a look at here in just a second as well. When you look at co-insurance, the amount that you pay, Medicare doesn't pay your entire medical bill, right? So if your hospital stay is greater than 60 days, you are responsible for $408 per day up to the 90th day, and then $816 per day up to the 150th day. After that, you pay the full cost, which, varies based on hospital and everything else. Medicare pays the full cost of 20 days of a skilled nursing care facility. After that, you pay $204 per day for days 21 through 100. If you need more than 100 days of skilled nursing, you pay the full cost. And for Part B, your responsibility is 20% of the Medicare approved cost. Doctors who accept assignment agree to be paid directly by Medicare and won't bill you more than the Medicare approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest, 20% of the 15% over. So I know that's a lot of kind of back and forth there. But, if you have questions, we can definitely, discuss this a little bit more one-on-one as well. Under the standard drug plan design, beneficiary pays a $545 deductible, and then 25% of drug costs after that deductible has been paid. And there's a small co-payment of once your out-of-pocket spending has reached $8,000. But as I mentioned, drug plans, vary widely. Some will pay more, requiring you to pay less. And it's important to find the plan that covers the drugs that you take as well. So after looking at all those out-of-pocket costs that you have to pay, you might be wondering, well, what in the world does Medicare actually cover, right? Well, it covers the first 60 days of your hospitalization minus the deductible. It covers 80% of your doctor's bills, and it covers some preventative services. Best reference for finding out what Medicare covers is the Medicare in You book, which you can get at medicare.gov or by calling the number that you see there, 800-633-4227. The Medicare in You booklet spends about 20 pages also talking about, it spends about 20 pages talking about what Medicare does cover, but only one page about what it doesn't cover. So we're going to take a look at that here. I'm talking about partial payments here. No, talking about no coverage whatsoever for the list of services that you see. So some of these things are, things you can avoid, like cosmetic surgery. And if you never go out of the United States, you don't have to worry about that. But some of the other things might be necessary, like dental work, eyeglasses, hearing aids. These are all things that you have to cover yourself. Now, I know hearing aids is something that's been in the news, a lot over the last couple of years. They're really exorbitant costs and becoming almost more necessary, it seems, in a lot of situations. It seems that there are a lot more kind of third-party type of vendors, maybe folks you don't think about when it comes to the medical framework, who are developing hearing aid alternatives. I know Apple is working on that, as well as some other places as well. Not an endorsement of those products, just kind of some additional knowledge that you might want to have in your back pocket. This is where private insurance comes into play. So private insurance can cover all or part of your deductibles, hospital costs after 60 days, 20% of the doctor bills that Medicare doesn't pay, as well as all the prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending on the drug plan you choose, it might cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period, but won't cover all drugs out there. All right, each plan has its own list of drugs called a formulary, and it doesn't cover much of anything if you're in what's called the donut hole, which is a fun little term where you have coverage, then you don't, then you have coverage again. So now to talk about Medigap policies, which are Medicare supplement insurance. These are issued by private insurance companies, and they're designed to fill in the gaps that Medicare does not cover. They are not affiliated with Medicare, but they do have to follow certain federal and state laws, which are designed to protect you at the end of the day. Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy, hypothetically, a Plan G in California, it's going to have the same benefits as the Plan G in New York, but your premiums can vary considerably from company to company and area to area. And that's why it's very important for you to carefully evaluate your Medigap insurance and make sure you're not paying too much for it. In particular, think about, if you move, a lot of folks maybe get onto Medicare, then retire, then maybe move to a different state. You're going to want to evaluate that and see, are you still on the right plan? Are you still, paying the right cost? This table, I know there's a lot of kind of info here, but what this shows is the various benefits for each of the various Medigap plans. This is in the Medicare and You booklet, so you don't have to memorize it. But again, you might want to get a copy of that booklet at medicare.gov. Main thing to remember is that when you're looking at a particular plan, it will be the same as every other plan offered by other insurance companies. So don't fall in love with an insurance company, fall in love with the plan that works best for you. You're going to want to make sure you're not overpaying for the same policy that you can get elsewhere for less, right? We hear a lot of times, folks say, oh, well, XYZ, my cousin or my brother told me to go with ABC Insurance Company because they're the best. Well, it really depends on what plan that they have. Two people with the same insurance companies can have completely different experiences, and two people with different insurance companies can have the same exact experience if they have the same plan, right? Now on to Medicare Advantage plans, which are also called Part C. So this is kind of an alternative to the Medigap or the Medicare supplement plans. These are still offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing care. Generally, you might have to use the network's doctors or hospitals. So you'll want to make sure that that works for you. You also want to make sure that you have prescription drug coverage, and you might even be able to get additional benefits like vision care potentially. But the benefits and cost sharing for Medicare Advantage plans are different than for original Medicare. So again, you'll need to shop carefully and choose a plan that best fits your needs. So again, just a reminder to, like I said, shop carefully for your private insurance. Medigap policies are standardized, but the premiums can vary considerably. So, first choose a plan that offers the coverage that you need. This is where, generally speaking, I like to refer people to a Medicare expert that we know. We have a few different, kind of contacts who all they do is help people with their Medicare plans. So if this is something that you need help with, if you don't want to do all the research and shopping on your own, we know folks who can help you with that, and they have no cost for their services or anything along those lines. Just reach out to us, let us know. We can kind of make that connection for you as well. All right, now we're going to come to part 3, which is preparing for higher healthcare costs in retirement.
Okay, so as we look at the chart, we can kind of gauge and look at healthcare spending by gender and age group. Women tend to spend more than men on healthcare overall, and older people spend more than younger people. A large part of these higher expenses are later in life, which really factor in things like long-term care is what kind of accounts for the bulk of the spending. But just wanted to kind of illustrate, what some of the trends have reflected in terms of just services, premiums, and what they've kind of had an impact on in different age groups and genders and things like that. Here's what a typical Medicare budget might look like today, considering just premiums only. The Part B premium, like we had covered before, is the $174.70. Medigap premium is about $200, and then the Part D drug premium is $40 for a rough total of about $414.70 a month. Considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend over $6,000 a year in premiums, non-covered prescription drugs and other out-of-pocket costs for things like dental, vision, and the alternative care that we had referenced earlier that wasn't covered under Medicare. What can cause your healthcare budget to change? It's really broken down into 2 things. One, obviously, we've seen it and heard about it so much in the last year and change, is inflation and just the possibility of getting sick. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself get more expensive. So if you do get sick, you may need more expensive prescription drugs. And there's always the possibility that as you age, you'll require more non-covered services like major dental work or hearing aids, as we mentioned just a few slides ago, or even just the need for long-term care. So how can you prepare for rising healthcare costs when you might be on a fixed income when you retire? One way is to really just set aside enough funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple may need at the start of retirement to fund all their future healthcare costs. This is not including long-term care, but they say the average couple will need about $315,000 in their lifetime to fund those costs. The Employee Benefit Research Institute did a similar study with a few slight different variables and came up with about $142,000 for men, $159,000 for women, and about $296,000 for couples. Again, because these are just averages, if you live longer than average life expectancy, or if you have just different healthcare needs, you might need more. But just remember that these amounts don't include long-term care, and they're just average, expenses that we would expect over a lifetime. So how many of you may know someone who got old and just needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from someone coming to the home for a few hours a week to help with meal preparation to literally skilled nursing care. So the range is pretty broad. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care. But if you're not sick enough for skilled nursing care, then they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. So before you say, I'll never get old and need help, consider this. 35% of people over 65 have activity limitations, okay? Some of them need help with the so-called instrumental activities of daily living, which includes things like shopping and cooking. Others need help with things like bathing and dressing. And so here we can see the causes of activity limitations for people over 65. More than half of this population suffers from hypertension, and nearly that many deal with arthritis. And these numbers take into account a wide age range, and we know that these conditions usually get much worse as you get older. So when you're healthy and active in your 60s, it's hard to imagine not being able to bathe or dress yourself. But it's just a fact of life that people need help as they get older. Okay, so nearly half of all people over age 85 have some difficulty walking, and this in itself can limit the things you can do for yourself. So for most people, the need for long-term care is very gradual. So you'll start off needing help with shopping, preparing meals, doing housework, managing money, and traveling. And this level of care is often provided by a family member or paid housekeeper. Then you get to where you have difficulty with these essential activities of daily living: eating, bathing, dressing, going to the bathroom, just transferring from a chair to a bed, and maintaining continence. If I know no one likes to think about these things, but we all know of people who have needed custodial care. And so that third level of care is skilled nursing care. And this care is provided by a licensed nurse for a medical condition or rehabilitation. Sometimes this level of care is not short term. And if you need it for 100 days or less, Medicare and Medigap might pay for it, depending on which Medigap policy you have. But sometimes skilled nursing care is needed for a longer period of time, and then the cost can become really burdensome. How much does long-term care cost? Well, it really varies with the type of care, of course, but Genworth annual cost of care survey shows us that the median cost across the United States, homemaker services cost about $163 per day, and home health aid services cost about $169 a day. Adult daycare can cost about $78 a day on average. And however, it can just range from about $30 to $160 per day, just to give you, an approximation of where it falls, give or take where you're at. Residents in an assisted living facility can range from $3,000 to $7,000 per month, depending on location and amenities. The median monthly rate is about $4,500 per month. The most expensive type of care, of course, is in a nursing home where residents can get skilled nursing care. A private room averages from about $200 per day to about $1,200 per day. So your median daily rate's about $297. 1 year at this rate, you're spending over $100,000. So it stacks up very, very quickly. So none of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids and other family members the burden of taking care of you. They may not mind doing your shopping and paying your bills, but if you were to need constant supervision or help with bathing or dressing, that might be beyond the call of duty for even the most devoted son or daughter. Another reason to prepare for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. The state-run welfare program will basically pay for your care if you don't have any money. But that's to the point where you have to spend down your assets to less than $2,000 in order to qualify, essentially leaving yourself destitute. People on Medicaid don't have a lot of choices about the kind of care that they receive. And this is another reason to prepare for your own long-term care, is basically be able to direct your own care and obtain the kind of quality of care that you want. So when you're paying for it out of the funds that you've set aside for this purpose, or when you have insurance that's paying for it, you can decide how you're going to be cared for, and whether it's in your own home or in an assisted living facility of your choosing. So it just creates a space of more flexibility and more control, which translates to more peace of mind. I'm going to throw it back to Emmett now to kind of recap with 3 reminders from today's webinar.
All right, awesome. Yeah, thank you so much for going through that, Josh, and thank you all for taking time out of your day as we wrap up. If you have any final, questions, thoughts, anything, definitely plop that into the Q&A or the chat. And again, just kind of to summarize, reminder number 1, enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at 65 or if you can wait until your employer or group coverage ends. And enroll when you need to in order to avoid penalties and coverage gaps. So very important. Reminder number 2, shop carefully for private insurance to go along with your standard Medicare. So make sure whether it's a drug plan, Medigap policy, or Medicare Advantage plan, that you're getting the coverage you need at a price that you can afford. Don't be somebody who waits, and who pays too much for private insurance because they, didn't know any better, or just found the first thing off the shelf. And again, if you need, some help with that, we've got, a trusted pool of resources who can help you with that as well. Reminder number 3, prepare for your higher healthcare costs in retirement. We know healthcare expenses will be higher down the road than they are today. So when you're preparing for your retirement, figuring out how much savings you'll need to make your money last, be sure to factor in an amount for healthcare, and you'll be very glad that you did as well. Health savings accounts can be a great kind of retirement pool of money to use for healthcare. So if you are still working and have access to a health savings account, maybe it's good to consider adding more into that than you currently need, because that money can kind of stay with you and be used for those long-term higher healthcare costs as well. And you get a lot of tax advantages and benefits for that. So, okay. So again, thank you all so much for spending time with us today. We hope to have this available on our website, wealthcycleadvisors.com, here shortly, as well as all other replays from all the other monthly webinars that we've done throughout this year. Next month, we plan to bring you a topic that is very timely in savvy cybersecurity. October is Cybersecurity Awareness Month. So we're planning that for, I believe it's October 22nd. Keep an eye out, and we look forward to talking with you then. Thank you so much. Enjoy your afternoon.